Welcome. I'm Dr. Marie Schambach from Guatemala. In this brief video, I'll present my refined preview long hair FUE technique, from setup and devices to surgical flow and tracking metrics. The goal is reproducibility with high graft quality and patient satisfaction. For harvesting, the patient lies prone with the neck flexed and Velcro strips securing long hair away from the surgical field. Securing it by sticking the soft loop side at the forehead and the rough hook side holding the hair upward. The surgeon sits at the occiput with one assistant directly flanking on the surgeon's left side, handling graft extraction and hydration immediately after surgeon performs the excisions, giving proper feedback. A second assistant counts and sorts on a separate table. For placing, patient is supine on semifular position and staff on the surgeon's dominant hand side. I use the WOW Slim device with a 1.0 millimeter hybrid tornado punch featuring Schambach notches. I set it to oscillation only mode, 90-degree arc angle, and speed below 20%. I avoid depth limiters and adjust manually, tailoring depth per scalp zone as per Otavio Boaventura's findings. My tumescent solution includes saline solution, lidocaine with epinephrine, dexamethasone, and a small percentage of bicarbonate. And I also use a 4 millimeter 30 gauge syringe for its subdermal application. Keep the hair moist with Ringer lactate spray. Due to a lower osmotic gradient, this avoids hair shafts from swelling and tangling and makes them slippery enough to travel within the incision. In prone position, assessing hair exit angles is a little harder, but we can increase the angle by pulling the scalp upward by the long hair or with the Velcro. The mnemonic CAPS standardizes the excision process. Center the punch on the infundibulum, align to neighboring direction of other hair shafts, press softly to tension the skin and create potential elastic energy, and only then start the oscillation, letting the handpiece dissect passively through the less resistant perifollicular tissue. To gently extract the graft from the scalp, use the mnemonic CLIPS, which stands for capture the long hair shaft, lift gently, identify the sebaceous gland, press the graft just beneath it to release from tethering tissue, and follow by skin parallel extraction to avoid torsion or trauma. You can produce easily finger receptacles with materials readily available on your operating room to help with keeping the long hair grafts moist and untangled during extraction. We limit graft out-of-body time to 120 minutes and store them in chilled Ringer's lactate, keeping shafts moist and healthy. We use an Excel form to log in the number of grafts and time of excision, the hair per graft coefficient, the graft and skin quality, the cut hair shaft rate, extraction and placement speed, as well as total and partial transection rates. Furthermore, technicians rotate every 90 minutes to reduce error. For the placing section, we use Lion Sharp implanters 0.64 for one hair grafts and 0.8 millimeter diameter for multiple hair grafts. One technician loads the implanters while the other one passes the implanter to the surgeon. The implanting technique per se follows the mnemonic BRAID, which stands for bevel insertion, rotate 180 degrees to prevent bend back of any follicle, angle to the natural direction of neighboring hairs, insert the implanter fully, and deposit the graft, leaving 1 millimeter of epithelium above the skin. For frontal male or female design, we work front to back, like tile roofing. This improves density visualization and architectural creation by seeing the spaces needed to cover. Long hair FUE offers instant cosmetic advantages and natural density on the next day, but post-op care can determine the results on the long run. We give post-op indications verbally and written and perform the first wash 24 hours post-op, not only for evaluation purposes, but to teach the patient the appropriate technique for cleaning and styling. Some tips that can be adopted for reducing the complexity of this surgery are using Velcro for improving surgical view, cut the hair shafts after extracting to a maximum of 3 inches, create finger-holding receptacles to avoid hair tangling, and moisturize the hair with Ringer Lactate. Long hair FUE is more than aesthetics. It's a precise and measurable technique. With WOW's oscillation device, tornado punches with Schambach notches, stepwise mnemonics, and ergonomic planning, it is reproducible. I look forward to sharing outcomes and collaborating with colleagues worldwide. Thank you.